Hi, my name's Dr. Alan, I'm a GP. This is a video to try and help people to understand how they should be involved in decisions about their health. So I often hear stories from people who say that they were told that they had to go into hospital, or they had to take a new medication, or that they had to have a test. And this is never the case, because it should always be your choice. And I want to try and explain a little bit more about that. So in the past, we practiced medicine in a way that might be described as paternalistic, where you came with a medical problem and the doctor just decided what should happen next. But we don't practice that way of doing medicine anymore in the UK. We do something called shared decision making, because there's never a single right answer, because everyone's different. What matters to you is different, and what your priorities are different, and there's always a range of options. So now, when you come with a particular medical problem, and our job is to trying to help you to understand the range of possibilities. Now, that doesn't mean that you can have anything. There's going to be some things that are impractical or or not safe. But there should be a range of reasonable options, and our job is to help you to understand how each of those may play out, and then it becomes your decision to make. The only exception is when someone is unable to make decisions for themselves. We call it where they don't have capacity, where they often say, for example, in dementia, where you can't make decisions for yourself. But that is in the minority. For most people, what we should be doing is trying to help you to decide, and that might involve, if you want to if it's a difficult decision, you're allowed to have somebody with you to help you to wrestle through those decisions, and you shouldn't feel pressured by a health professional to do any one thing in particular. So something that also might be helpful to think about is to take a step back from that medical decision and think what matters to you more broadly. So is it that you want to live as long as possible? Is it that you want to stay at home? Is it that you want to be free of pain? Are there things you want to achieve in life, or things you want to do? And so we need to try and help make sure that the plan for you is something that will help you to achieve those things. And that's more important than us kind of doing guidelines and ticking boxes, because this is your body, and you should be able to decide what happens to you. Now, some questions that might be useful in these situations is to ask kind of what your options are, and how you think each one of those different options may play out. If you feel that you're being pressured into a decision, you could just ask, whose decision is this to make? And it will clearly always be it's your decision, and sometimes that could be a helpful question if you feel that you're being pressured. So so it's really important that if it's a medical decision that you're involved, our job is to help you to understand the options, and it's your decision what happens.